Don't rush your fences. So just after 11:30, not 1:30.
Sorry, my brain's not switched on today, obviously.
Had a panic there.
You're just wishing to get to the end. I know.
Oh, it's cold.
Must be a good lunch you've got planned. Does somebody need to do something so we can go live and then we can get kicked on?
Yeah, we'll just, Jess, if you could confirm that we've pressed the button, we can start.
We're now live?
We are.
Okay, well, welcome everybody to this public meeting of the Health Education England Board. If you're listening either live or on the recording, then you're very welcome and thank you for joining us today. Thanks to colleagues for joining. Nicola, could you just do apologies, please?
We have apologies from Sir Andrew Morris, Lee Whitehead and Wendy Reid. Okay, thanks very much for that. I'm going to miss somebody out here, but I think Vicki Matthews is joining us as our new Director of People and Culture. So Vicki, thanks very much and a big welcome to you. I should have done that earlier in the day, for which my apologies, but you're very welcome, Vicki. I know there are other colleagues joining for various items, so we'll just make sure we introduce you as we go through the various items rather than me attempt and fail to actually do that as we go through the introduction. So if I could go on to the register of interests, the paper's there at item 2. Does anybody want to amend or update any of the interests which are declared as part of the schedule? No. Okay, if we could just ask that that is noted. If we could then go to the minutes of our meeting, of our last meeting, and the meeting was on the 16th of November. Any matters of accuracy first, so I'll go through them page by page. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Navina?
Yes, thank you, David. Under the item advancing dental care, in the it says at the end that the board agreed to seek board-to-board discussion with NHS England. I think that's not quite, that point was discussed, but that wasn't what we agreed. In fact, Sir Andrew Morris did let us know that the NHS England board were going to have a special deep dive session on oral health, and that was going to be the action to raise its profile with our partners.
Yeah, thanks. So the amendment should be that the action was a NHSEI board item on oral healthcare rather than as a board-to-board. Yeah, fine. And I just wonder, we've got the agenda planner coming up, whether we could ask Sean, I think you're here for Wendy, if we could just schedule in an update on the dental reform programme into our planner, so the board can keep visibility on this. I think I think the notes capture just how important this piece of work is in improving oral health through improving the workforce supply, and I think it'd be good for the board to be able to keep this in view, quite frankly, and therefore I think it should be built into the planner. Are there any matters arising that anybody wants to raise on the minutes? No. Okay, thank you for that. So if I go on to the agenda planner, any comments anybody wishes to make on the proposals for our meetings through the year? I think Andrew, George, are you?
I just wonder whether we should put a merger on it.
Yeah, I think we should. And I think just coming off the back of our last meeting, I think we can begin by just scheduling a special meeting that we've agreed to take to actually spend more time considering the creation of the new organisation. Perhaps that's how we should begin to record this. It's the creation of the new organisation, I think. But thanks for that, Andrew. Any more comments on the forward planner? Pretty much gets us through to the spring of this year. Okay, with that, updates from committee chairs. So John Latham, I think you've joined us. Do you want to? No. Yeah, no, that's right. We can do this, can't we? The 16th of December was the audit and risk. Sorry, I was getting confused. I think you've got an audit and risk committee coming up, haven't we? But we
have got an audit and risk committee. Yeah, we have got an audit and risk committee coming up, and actually we're doing the planning for that very soon. And obviously, a lot of changes since the last time that we met, and the merger and the sort of aspects of what we're doing there, I think are going to be quite key. I mean, overall, I thought the meeting was very good. We're obviously very early on in the moment in terms of doing the planned audit process that we're going through, and I think that the new auditors themselves are settling in to the things that we need to get ourselves engaged with. So I think we'll give it this meeting, see how the new contract is going, see how we're actually delivering against those, and basically I think by the next board meeting we'll have much more of a fuller update from the audit committee, but nothing particularly difficult for us at this point in time, new into the cycle. I think the overall review through the main aspects of sort of legal cases and everything else that we've been reviewing, pretty standard really, nothing particularly difficult.
Okay, and I think your point about how the creation of a new organisation and the transition to that organisation features through the programme for audit and risk during 22-23 is important, isn't it? So thanks for picking that up, John, as part of the committee's work. Andrew, George, Performance and Business Committee meeting on the 6th of December.
Thank you, David. We received a report on the supply of midwives, which had been raised previously, and while there was a concern by some members of the committee that the midwife to birth ratio was slightly odd, but that is outside our gift. The main issue is around whether growth was in the right places. There's a lot going on, but whether we're getting the right growth in the right places. But we had a joint discussion with some members of the Audit and Risk Committee around streamlining data, and looked at the current position of HEE and talked about preparing a single overarching strategy to make sure that people are responsible and working with the KPMG recommendations, and clearly building links with digital first as well. We thought that we should probably do this in a small area of business initially, a small but key area of business, and get it working, and then do it. And then we also received a paper of value for money, which was received a paper based on the HM Treasury. And I think one of the things that we really need to do is define what we mean by value for money in our context, and then how we might link that through to benefits realisations. There's more work to be gone. And just to report, there's a workshop going on this afternoon around our work as well. So we're going to be looking more at our practice as well this afternoon. So I think things are going well, and we're beginning to incorporate the business part of our title now into our work. Thank you.
Okay, thank you, Andrew. Any questions or comments to Andrew from colleagues? Nope. And then Audrey, establishing the quality committee.
Thanks, David. So back in December, we had two key meetings. One was a workshop, the quality workshop led by Derek Feely, and obviously we then brought this on the second meeting at the board workshop where we discussed this in a bit more detail. Just in the final stages of thinking about, what the committee will look like in terms of reference to membership, but also where the main focus of the work for the committee would be. Navina highlights this in board workshop, but this is critical that we look at it from our people, our business, and our influence. And I think those are the three kind of key criteria that we're pushing forward. And in particular, with the merger, the expectation is that the committee will be standing and up and running because it plays a core role of what we're doing and ensuring that we maintain the quality assurance on the training and the business. So we hope to be kicking that off ASAP, and we'll have an update on that in the coming weeks.
Thanks, Harpreet. Again, any questions that anybody wants to follow up? No. Okay. Let's push on then. Navina, your report, please.
Thank you very much. May I begin by wishing everyone a very happy new year. I'm looking forward to 2022. I think I'm coming to the point where you can't say happy new year anymore, so I want to get that one in. I think we've got a challenging but exciting year ahead of us here at HEE. Next, I'd really like to welcome Vicki Matthews as our new Director for People and Culture. We're really thrilled that she's finally joined us to take forward our agenda on people, culture within HEE, but also towards the new organisation that we'll be joining. And of course, I'm very excited to congratulate our Chief Nurse, Mark Radford, and Deputy Medical Director, Simon Gregory, who both received well-deserved honours in this year's New Year's Honours list. So we're all very proud of the both of you. I outline in detail in my report, but I'm just going to pick a few areas to just highlight in right now. The first being transition to the new organisation. So we've talked about this. There is a paper coming to the board meeting later on this morning, so I won't say very much more, apart from to say that there's good work together in partnership with NHS-EI and NHSD, NHSX colleagues. So that's going well. We're working with our staff who have raised concerns, questions, and we will highlight that. It is our intention that we will bring an update on our work towards a transition to every board meeting. Next, I just want to mention an update on our work in COVID. As we will all be aware, there's been considerable pressure in the wider health and care system, and this has impacted on our learners and trainees. And so staffing challenges especially has been a real concern. We have been actively engaged in all the discussions at all levels around resilience, contingency plans, and how we support the system to continue to deliver service, but at the same time maintain a priority on training and the needs of our learners. So that has continued in a very active way. Just an example, when London's COVID activity was surging, and there was a concern about pressures from staff sickness, the HEE team in London worked really closely with around the military deployment into NHS services. So, that was another example of how we work very closely to support our colleagues. I want to mention the vaccination program, most recently around boosters and the rest of the vaccination rollout. So we, again, have played a really important role in supporting the program, and really proud to say a number of our HEE staff, more than 180 people, volunteered themselves to support the program, and especially over the festive period. Very quickly to mention our work on our mandate. It's that time of year again, so we are going to make sure that the transition into the new organisation features and there is a focus in the mandate for this year. It's really important that the mandate, of course, covers the aspirations of the government's manifesto commitments, on additional registered nurses, GPs, primary care professionals, and also continuing to support the continuing response to COVID. So we've started to prepare the draft, and again, it will be reviewed once we get a confirmation of our budget, and we will take forward the process of agreement with NHSEI and final clearance. Very quick mention on the work on the strategic framework. Despite all the other pressures and changes that are happening, the board is aware, we talked about this before, that HEE was commissioned to produce a strategic framework for future workforce planning in partnership with between health and social care. So we continue. We had a second deliberative event. We had more than 200 attendees. It was a really lively event with a lot of ideas to take forward. Work continues in the meantime, and we have had to shift the timings for the next events, but we're doing a lot of work in between times. We will bring an update to the board, and we'll have something to share with colleagues, with the minister in the spring. And this opportunity of working closer with NHS-E&I means that we can take this work into the integrated planning for the short, medium and the long term. I want to just give a shout out to about our Knowledge and Library Hub. The HEE funded Knowledge and Library Hub as a one-stop gateway has been launched, and I really recommend, I want to use this opportunity to plug it and really recommend that everyone has a chance to have a look at it and use it. I'll stop there and take comments or questions. Thank you.
Thanks, Navina. Very comprehensive. Thanks, and an awful lot packed into that report. Questions, comments from colleagues? Andrew, please.
I was just reading the section in relation to vaccination, where you talk about the efforts that our staff have made to supporting the wider vaccination program, which is, of course, highly commendable. I just wonder what the situation is on our own staff being vaccinated. Is that something that we have a policy of as an organisation? Do we monitor the rate of vaccination take-up? Do we have a view on those who have not been vaccinated?
You want to come back on that, Navina?
Sure. So we've done a lot of work throughout. In fact, some people, HEEBoard has helped us in terms of supporting our staff to get the vaccination and made it easy for people to go and access and get their vaccination. So we do that. We do not collect vaccination status as an arm's length body employer. And anyone who is concerned or worried, we encourage them to approach and talk to us about it. So that's what I don't know if Vicki or David Farrelly, you want to add anything else to that response?
Got nothing to add.
No, I think the vaccination as a condition of employment regulations apply to CQC regulated services, and STEM services largely trusts and provider organisations that are collecting data. And we are looking with Mark around our responsibilities to understand the trainee population and vaccination status of them to support trusts.
And what about the people that have joint appointments? So the people that are part funded by employers and part funded by yourselves? That is, I guess, who holds the contracts is less messy, but they will be working in regulated services by definition, I suspect. Yes, so there is an expectation that they will comply with this role and what's required. Okay, all right. Andrew, are you content with that? You're on mute, Andrew.
Yep, yes, thanks, I am. It was just a sort of small question in passing.
No. It's one that I've asked Navina on 2 or 3 occasions about just how we sit compared with what we're asking others to go through and what our leadership role is, quite frankly, I think. So it's an important question, I think. So thank you for asking it. Liz, please.
Thanks, David. In fact, thanks, Navina. And it's great to hear that the long-term strategic framework planning meetings has been postponed, not cancelled, because the first two events have been absolutely excellent and brought together a wide range of stakeholders. So great to hear that that's part of our planning to make sure that this is real, that we need to move it back a month. And just a further plug for the knowledge and library services. So when I was in the NHS and leading partnership organisations, use the hub frequently to look at evidence-based sources of knowledge and how we could use that in service. But also the people that work in there are very helpful to come out to service to help you to recruit evidence-based specialists and just to work with you to make sure that you're planning services properly. So great to see them mentioned in this paper.
Thanks, Liz. Soraya?
Thank you, Navina. And just to really echo how positive the sessions have been with staff around the transition and the changes that are happening. I think they've been really positive. And I just wondered, in terms of as you progress, because you're doing them so regularly, the themes that are coming out in terms of the areas that staff are showing perhaps concern on, what support we're putting on. It'd be really good to get a report either through People and Culture Committee or back to the board, but just to really say, well done on that. Thank you.
Okay, thanks. Anybody else wants to come in? Can we just say something, Navina? I don't know whether it's you. I think Sean is on for Wendy, and Mark might have a view. Just what it's at the top of your report. It's the second item, which is the impact of the current outbreak of Omicron and the arrangements that have been put in place to actually deal with that. I think we're at level 4 now, and just what impact that is having on both medical education and nurse education. I'd be just interested in trying to get the scale of what the impact is. You flagged, Navina, the impact in your report, but I just welcome some sense of scale, because the people that will graduate their nursing degrees this summer will have had every single year of their undergraduate experience affected by COVID arrangements, and so will some of the medical undergraduates who have had, a good 3 years of their education affected by it. I'd just be interested in Sean and Mark, your reflections on the scale of it, please. And what it means actually as well for catch up. It's not give me a number, it's more what's the scale of it and what do we intend to do about it.
Mark, are you going first?
Oh no, you first, Shona.
So David, I'll leave Mark to talk about the undergraduates, but in medicine, we've had Liz Hughes in continuous discussion with medical schools to make sure that we can graduate our doctors. We feel they're on target. The real concern was about dental undergraduates and the need for their training to progress because they had been so severely affected. When it comes to postgraduate trainees, we've been working with all the regions through our postgraduate deans to understand what requests there are for redeployment, and we've been monitoring them, and there are very few. So the impact that we feared at the start of this wave of pushing trainees back further because of redeployment hasn't been realised, but obviously there has been some elective cancellation which will have an impact. I think the biggest impact we're seeing is that trainees are being asked to do extra sessions rather than be redeployed. And so we will see an even greater impact on their well-being and morale after this. And that's the main concern at the minute.
Okay. So these are extra clinical sessions.
Extra clinical sessions because so many staff are sick. The major impact before was being redeployed and missing learning opportunities. Very few trainees have been redeployed. We're monitoring it. It's very low numbers, and it's at a stage where they can still gain competencies. But large numbers of trainees have had to do extra shifts because so many of them have been off sick.
So they're not trading off the extra shifts with learning opportunities. They're getting the learning opportunities. It's just that the demands on them are greater than they've hitherto been.
Yes.
Yeah. Okay. All right. Thanks for that. And what's the scale of it, Shauna? Is that is it very variable across the undergraduate and postgraduate trainees, or is it pretty consistent across the country?
It's been more obvious in London and then up in the northwest, but it's beginning to affect elsewhere. And as we've seen, Omicron is all around the country. So I think the effect will be across the whole country in the end, though, as with the other waves, we've seen it first in the south.
Yeah, okay, thank you. Mark?
Yeah, thanks to David and colleagues. Shona's right. I mean, we, as an organisation working in partnership with NHS E&I, but also the wider stakeholder community of student leaders, as well as our union colleagues, and of course, importantly, the university sector, have done a lot of work over the last 2 or 3 months in particular, looking at the risks we took out of the last wave of the pandemic. And it was evident that obviously the experience of the students has been really severely affected. And personally, I have to thank the students themselves, their educators and their universities, because I know they've done a lot of hard work to make sure that they can catch up hours that they would have lost, but also importantly support individual students to complete, as well as also look after the pastoral elements, which are really quite critical in this student group. As Sir David rightly pointed out, our third years will have known only 3 months of their training out with a pandemic. So we have to recognise that the impact that the NHS staff would have experienced is also impacted on what our students and learners and trainees would have appeared. So we've got a real important focus to do that. Prior going into the Omicron wave, it was evident through our engagement and student leaders and also universities were recognising that any further disruption would be a serious detriment. So we've been working with NHSE, others, around the policy support position to continue placements as far as possible during the Omicron wave to ensure that we're able to support students in completing their programmes, gain experience, of course, and do so in the best way we can during a pandemic and a wave of this nature. We agreed that policy position with NHS England prior to the Christmas break after thorough analysis and assessment. And of course, in addition to that, we've widely engaged with students, unions and university sector on that position. Of course, during the wave in the latter part of December and early January, there were 1 or 2 who suggested, of course, that we should redeploy students. But of course, we recognised that that there were other opportunities and solutions applied by our organisations. And at this stage, we are still of the position that further deployment to students would cause further concerns to the students themselves, but also massive disruption to their training pipeline. Of course, the number of students that are delayed has declined, but we still had a small but important majority of around 2,000 students who weren't able to graduate on time this year. I'm pleased to say that a lot of those students have now started to graduate, complete their programmes and start on the NHS workforce. But of course, we will still continue to support some students beyond this point as they try to complete their programmes during the disruption that they've faced. Our focus really for the remainder of this year is, as Shona said, to focus on the health and wellbeing and support offer to our students. And importantly, a question that students, trainees and learners raise with us, which is that they feel competent to do their work in terms of their graduating, but their confidence most definitely is an area they would like more support on. So again, working with the university sector as well as NHSE about the support requirements that are needed when people transition from being a student into being a qualified member of staff working with whatever area we are. And of course, as colleagues will know, this has been a real growth area the last 2 years. We've seen in undergraduate nursing a 34% increase in undergraduate numbers starting our programmes. These are now flowing through their programme cohorts. So we've got a lot of work and coordination to do with our regions to ensure that we're able to give placement opportunities, deal with some of the backlog issues, as well as also importantly continue to reform and develop some of the quality initiatives that we want to with our university partners.
Okay, very good. Shona, Mark and your respective teams, thanks for that. Both the support, but also this issue about how we can preserve the education and training of students so they're good to enter the workforce in good time. Again, this trade-off between the short term and the longer term, or the medium term and longer term, I think is quite important, particularly when the service is under such pressure as we hear on a regular basis. Just ensuring the supply of clinical colleagues to enter the workforce this summer is particularly important, I think. So thanks to both of you and your teams for what you do. And then lastly, and just very briefly, Callum, I see you've been awarded the NHS Finance Leadership Council Award for Future Focused Finance Towards Excellence accreditation. Do you want to, Mark's applauding you. I wouldn't mind knowing what it means before I applaud you, but if you tell us what it means, then we can all applaud you. But just give us a few words on what it means, please.
Right. It's muted applause will suffice. But I'm very. It's essentially an award that finance teams get within the NHS to show you've met a certain standard. And we've actually had the accreditation for a few years, but we've essentially been re-accredited with it, so that's great. We now want to move on to level 2, so we've still got plenty of stuff to do, but it's a really good testament to the way the function operates and the quality of the processes we have. So I think well done to all those in finance, funding, and commercial.
So it's an independent verification of the standards that you're operating to, basically, is what the award is.
That's right, yeah.
Yeah. Let's turn the applause from muted into slightly noisier than that, and just congratulate you and your team and say thank you for testing yourself against those external standards and actually coming through so well. So well done, Callum, to you and the team. Let's move on. So I think that brings us to item number 7, which is digital first. I think Patrick, you're taking us through this. Patrick,
thank you.
There's 20 minutes for this item. I'm going to then have 15 minutes on transition, 20 minutes on rural, and 20 minutes on commercial, and that gets us to the end of the meeting. So I'm asking everybody that's presenting to respect the discipline of that and accept that we've read the papers, please. So can we please keep presentations to a minimum? Thanks. Over to you.
I hear you, David, and I'm joined by James Freed, our Chief Digital and Information Officer. And James, if you want to put the slide up so we can kick off. If I can remind the board, Navina last year set out an ambition for HEE to be a digital first organisation, and we agreed to establish a task and finish group, which was co-chaired by Liz Mears and Navina. The board has now had 6 meetings over the 12-month period, supported by the team and by Gartner, and we've come up with this case. First slide, please, James. I'm clear that, it may not be so clear in the paperwork, for which I give an apology. We are not asking the board to approve the finances today and that level of investment. What we're asking you to do is approve the approach that has been set out and the rationale, the outcomes that we've set out, and that you are happy for us to then take the business case to our operational delivery group, the ODG, apologies for the acronym in the paper, the operational delivery group, to then sense check for value for money and for the investment we can afford in this. The presentation, you'll be pleased to know, is going to be very short. But I just want to put 5 key bullets out. This is about user-centric design. We design around our customers, our trainees, our learners, and our educators. And do so through our digital systems and tools. It is about behavioural and cultural change and not fully around the digital world. It has a wide-ranging scope. It is about incremental small improvements. I think during the Task and Finish group, we got caught up in this was about big bang, big systems, big box investment. This is about small ongoing improvements to our digital infrastructure. And it's about being able to accelerate that improvement in our digital tools and our systems. And we're keen to clearly start this and take it with us during the transition into the new NHS England. I'll now hand over to James, who has a short presentation.
Thank you very much. Thanks very much, Patrick. So first, we need to wrestle with a definition for digital and an aim for the programme, and this is that aim. To meet our customers' needs ever better by enabling our people to measurably apply the behaviours, practices, processes and technologies of a modern, changing world. Ultimately, Digital First is about reconnecting with the reason we exist and aligning how we behave, operate and conduct our business around that reason to meet our customers' needs better and even better tomorrow. We use the language of our people, our business and our influence to describe our customers. Many of the services we provide in HEE are about making it easier for our people to do their job, to deliver more value and to have a better experience. Digital First is one of those services. Everything we do in Digital First is about helping our people to deliver more value and to help them to improve the experience of that service for their customers. Our business includes 3 customer groups: learners and trainees, educators and employers. HEE offers services to all 3, increasingly through the coordination lens of the ICS. It became obvious when we discussed this aim that Digital First needs to be about much more than just good technology, and we were aware from work we've led through HEE's Digital Readiness Workforce Transformation Program that influencing how we behave and how we work would be at the centre of our program and this business case. The case itself is based on a significant amount of evidence, and we prioritised 4 elements that give us the greatest value for the least effort. One thing that we're all agreed on was the writing down what was needed to change around how we work and how we improve will be needed. We've called this a new organisational model. This will help us move to an organisation that enables decisions to be made quickly at the point of expertise, mostly by small, autonomous, multidisciplinary teams, empowered to deliver the most value as quickly as possible to their customers. This will require consistency in approach in all our culture and change initiatives, particularly between Digital First, the work around learning management systems, and our operating model and improvement or QI approaches. Such a fundamental cultural change will require significant efforts in training and supporting HE people at all levels to apply a customer-first philosophy well and consistently. We're inspired by what are known as agile principles, derived from the digital industry, but now increasingly applied in fast-moving organisations keen to have a customer-centric culture. In the process of investigating the problem we wanted to solve, we identified that not all HE services ask customers their opinion on the value they get or the experience they have. More concerningly, we found almost no evidence that when data on value and experience is captured, it's acted on. The element of the business case called customer engagement and marketing recognises that a technical and methodological infrastructure for engaging with our customers better and across traditional functional silos requires investigation and investment. As part of our Future of Work survey, 477 staff identified between them 880 relatively simple ideas for how technology could help them automate elements of their work. We've analysed this list and we estimate that between 25 and 50% of those ideas could be addressed with technology HE already has access to. The element of this business case recognises that some investment is required to make these technologies safe and available and support teams in redesigning their processes. As time goes on, we'll invest in other productivity tools and support teams in their own major tech investments. I'm going to briefly show you 2 case studies, one for a large technical investment that HE is likely to be making relatively soon, and one to illustrate the impact of the many small changes we anticipate will come about because of the support we put in place through this programme. In the course of their training, many clinicians undertake on-the-job learning through placements at health and care provider organisations. These placements are paid for by HE and are an important element of the training experience and learning journey. However, our information on them is limited, and that impacts our ability to make changes that improve the value, quality, impact and experience of these placements. We provide a service to deliver placements as part of a training programme that prepares trainees for the work they'll need to do in full employment in a way that gives them confidence and competence in a value for money way and through an experience that they enjoy. The Digital First programme will work with the team responsible for this service to create the technology needed to underpin it and its improvement. We'll start with the ultimate reason for this work, the learner or trainee. We'll make sure that they're involved and their pains and needs are understood and met as part of the programme. We'll make sure that the team has the right skill set and is able to, and empowered to make these changes they need to ever improve the value, quality, impact and experience of these placements over time. We'll make sure the underpinning technology is reliable, safe, secure and value for money, solves a whole problem for our trainees and is joined up with other services aimed at them. We'll also make sure everyone can use it. In some cases, that may mean not using technology at all. Taken together, this true partnership between a business service and Digital First will prove that we're making more of a difference today than yesterday, every day. Some of you may have been expecting this business case to present the next TIS or the next TEL. In many ways, this case is not about a single 100% change, as Patrick mentioned, but 101% changes. It's been a tremendous pleasure to work with the 114 self-nominated digital champions. They've helped us to understand what changes we need to make, and they helped us to quantify our possible impact. I won't talk through this example from David Short, who's an analyst from our Northern Workforce Planning and Intelligence team. We saw 14 champions step up in November and conduct process change experiments that will, on average, save HE about £10,000 a year. Digital First used this time to see what could be done when you give people time, permission, a little bit of learning about user focus and a little bit of access to technical expertise. Just from our experiments, we think we've saved HE between £50,000 and £250,000 a year. That was in 1 month, working with just our digital champions. Although the Digital First case is based on an argument of improving customer value and experience, not on a return on investment argument, we don't think it's unreasonable to estimate a return of between £4 and £16 million a year on a £2 million a year investment by supporting everyone in the organisation to make safe and focused improvements through the approaches we've been using. Importantly, our impact will be measured by teams all across HE delivering services to our key customers, employers, educators, and most importantly, learners and trainees. If we're successful, every service will measure the value they deliver to their customers and the experience those customers have. The Digital First programme will work with those teams to set baselines, ambitions, and create an environment where everyone is able to contribute to that shared goal. As a result, we anticipate HE's reputation will improve as an organisation that's truly centred around the needs of its customers. Finally, the executive team have been clear that we will need to reduce digital risk, demonstrate digital value for money, and reduce our environmental impact. 3 things that we will measurably improve, partly through this case and partly through existing investments. Although Digital First cannot own our ability to meet learners' needs better, for instance, we do need measures to demonstrate our success. The Task and Finish group have helped us to choose these 3 proxies that we can own. We're already starting to measure HE people's confidence through the use of the digital literacy self-assessment tool developed by the Digital Readiness Programme. We'll find a useful measure for competence as well, and use these measures to set a sensible baseline and ambition for the programme over the next 6 months. One baseline we do have now, thanks to the We Are HE survey, is an understanding of how our staff rate technology we offer them and their customers. 70% of staff felt that the technology we offer broadly meets their needs and those of their customers, and we'd like to set an ambition for 80% responding positively by the summer of 2023. Finally, a key element of internal happiness is the provision of quick and effective governance processes, and we've agreed that a shared ambition for Digital First and the corporate governance team is to reduce the average time to navigate our governance processes. Again, we intend to set a baseline and ambition for this measure by this summer. So what do we need from you? Today, we're asking for a recognition that to be a truly excellent organisation, we need to focus much more on delivering better services to our customers. That this requires investment, focus, and a willingness to reconsider how we all view HE. Tomorrow, we'll rapidly need a concerted and joined-up approach to improvement and change, empowering teams to deliver better services and basing decisions on data that enable us to ever better understand our users' needs and meet them. We will support you as our most senior leaders with training to that end. And throughout, we hope we can count on you for patience as well as ambition, and we hope we are all able to apply use of the language of services and customers. Thank you very much.
Okay, thank you. Patrick, will you just focus on what we're being asked to do today, please, and then I'll wrap this up.
Thank you. I think invite Liz as co-chair of the group just to give her views of the 6 sessions and have we covered what the Task and Finish discussed. And then I suppose to open it up to have we got the ambition right? Is this something that people have understood in terms of the approach we're taking, and what next would they like from us?
So
Liz.
So just, sorry, before I bring Liz in, can I just be, are we being asked to agree a business case or not?
No, you're not being asked to agree this business case. You're being asked to agree the approach that's set out in the business case and agree that the ambition that we've set within this is right and that the approach that we've set out is right. Clearly, the financial side of it has to be worked through the operational delivery group.
Okay, okay. Thank you. Liz, please.
Okay, so I'll just be really quick, David. So I've been co-chairing this with Navina, so Navina might want to come in as well. And we've had 6 really well attended working groups, mainly with people from the regions, to look at how we support staff to be digitally confident and competent, because we've got some staff who are expressing the view that they weren't as confident as they could be, but also then to look at how our digital tools and processes meet customer needs, and the regions were able to bring that perspective into the meetings to think about, right, are we doing the right things? Are we serving the end users and our customers here? So I think throughout the meetings we refined the aims. We had some case studies brought along, some of the digital champions attended, just to give us some very practical ideas about what we could do if staff felt confident and competent to run with different things and apply them in the workplace. So I think the presentation was great. I think James summarised it really well, but I think it's been very positive. And one of the questions obviously we've been asking is, in the transition, can we use this to support some of the work in the other organisations who might not have done the same work? Can we be an exemplar in pulling this sort of work across? We think the answer to that is yes. So Navina, I don't know if you want to add to that.
May I come in?
Yeah, please.
Yes. So again, just to reinforce the challenge that was set to us as an organisation by the board about how we are in HEE keeping up with the world of the changes in the digital space. So this is the work that we've done. We know that we cannot deliver high quality, value for money business outcomes without embracing digital advances. And it's not just about tech or kit, it is about how we behave as individuals, what our systems and processes are like. And we know that this is something which is really important across the whole of health and care. So, so this is kind of, we think we need to really challenge ourselves, and this is our outline for what that could look like. It's quite a difficult piece of work, but we feel we need to do it. The next thing I want to say is, of course, we started all this work before the news of our transition into the new organisation. And I think that now gives us an added sort of almost sense of urgency to get on with doing this. Have started and started having some exploratory discussions with our partners in NHS Digital and the leadership there. And actually, it's those, they have similar sort of priorities about the fact that this is a large scale change of how we deliver what we do as organizations. So I think one thing I would add now, James and colleagues, is that actually we need to make sure that this work is aligned with the program that is in the new organization, and we need to talk to our colleagues there. So some of the changes that we want to make and can be realized across with partners sooner rather than later. So what do we want to spend on? What do we want to invest in? Should we be doing that across the partnership and with views to the new in organisation? Thank you.
Callum, I'm going to ask you, is this affordable? Because there's a business case here. This is the paper that was circulated with a view. So I want to come back to that as we begin to finalise our budget. It's confidence. So it's not just, is the ambition correct? My question will be, can we resource the level of ambition that's demonstrated in this? The two things go together. And I think Vicki's comment in the chat box is important. For those that don't have access to the chat box, this needs to plug into the cultural work. As soon as it becomes behavioural, it needs to be integrated with those bits. It's not just about digital, it strikes me. Listen, we've now got 4 minutes to have this discussion. If I'm going to manage us to get in and out of the rest of this agenda. So can I have comments from colleagues, please? Soraya.
Thank you, Sir David. Very supportive. I thought it was a really good paper, absolutely the right direction of travel. Two very quick questions, and I'm really glad, Navina, you've built into the conversation the newer organisation and actually working across with NHS Digital. Just a question around our own maturity as HEE. What's the assessment there? Do we have the background in our IT systems in terms of data security, cyber security, etc.? So a little bit more on that, I think, is critical. And has that been added into the business case? Is there stuff that we will need to do to get up to an appropriate level there? And then the other question is around our people. I think from the paper, as I'm reading it and the comments, people are very, very positive about that. But implementing any of that change is so fundamental in terms of people adopting and wanting to do that. What's the general flavour? Is this sort of 80% of our people are behind this, or are we going to have issues around or challenges around some of the implementation? Because that will be resource intensive as well.
Did you want me to respond to those now, Sir David?
Let me just see who else wants to come in, James, and then the floor is yours, and I'll give Patrick the last word. Anybody else want to come in? No, the floor is yours, James.
Thank you. Well, very quickly then, thank you for those two questions, Soraya. The first one was around maturity and security. So we've undertaken a baseline maturity assessment through a company called Proactivity that assesses 6 different dimensions, including underlying infrastructure, security, and the like. As you would anticipate, the level of maturity isn't exactly the same for all of those. So in some areas, we're actually very mature, security and infrastructure being one, partly because in comparison to many NHS trusts, we're actually relatively well invested in. We are, for instance, Cyber Essentials Plus certified, and the work that Martin Hall and the IT team do is excellent, and I can't claim any credit for, I'm afraid to say. There are other areas where we need more work, and we highlighted in the business case in particular around our focus on user needs and our focus on a word that's a little bit of a dirty word in the NHS, marketing, which is really on how we make sure that we get the greatest value out of the services that we provide by helping people understand how to interact with those and to create a unique experience for our customers, which we don't do quite as well on. So they're probably the highest and the lowest levels in our maturity assessment. Your second point is a really important one about adoption. So what our research has indicated is that there's a fairly typical normal distribution. There are some people who are really excited about the idea of change. Many of those have volunteered to be digital champions. I should also say that our digital champions don't have they're not all digitally advanced. We've got a very wide range of digital ability within that group. The one thing that they have in common is that they want to make changes relatively quickly. There is also a fairly shallow tail around people who are less enthusiastic, and we'll have to manage this in concert with, and in keeping with Vicki's comment, in concert with our Best Place to Work programme, because it's a fundamental cultural change, and that makes it unfortunately not easy.
Okay. So I think, Patrick, do you want to have the last word on this?
Last word from me is I think we've got the people with the right digital skills and the IT infrastructure to deliver this, and through the Best Place to Work initiative, that along with Digital First and Future at Work initiatives are all working together as an entity around the cultural change piece. So my sense is, based on the questions being asked, we do have the right people and the right skills to make this happen. So grateful for the questions being asked today.
Okay, so I think you've got a sense of support to the ambition, first point. I think there is an additional point, Patrick and James, and I think that is, how do we get alignment with the creation of a new organisation and the transition to that? And I think we talked earlier about our new director leading the PMO, and I would expect that connection to be made with the work that Philippa is doing. And I would also ask, Callum, when we begin to finalise the business plan, we actually convert what is in the report which came to the board about what the resource implications are, that you flag both as a priority the delivery of this programme during 22-23, but critically how it's going to be resourced as well, because you've not invited us to answer those questions today, Patrick, but they were the questions that were posed in the paper that came to the public board, so they do need to be answered as we go forward. So they're the three things: ambition, yes; alignment with the transition to a new organisation; and clarification of prioritisation in the business plan and the resources for that, please. Okay, James, Patrick and the team, thank you for that. Liz, thanks for co-chairing that and bringing that work to this stage of development. So I think that now brings us to managing the transition. And Navina, are you going to take us through
I will be. Thank you, David. I will be brief in my introduction. It's a very short note, that paper, that just literally we wanted to make sure we marked the fact that we're going to be moving into a new organisation at Public Board, and just outline at this present time that very high level work that we've started to do and the principles of how we're going to do this. As I mentioned in my Chief Exec report, we've done quite a lot of work in the organisation, talking with staff, working out how we're going to set up project management to take this forward, to deal with the people issues, the contractual issues, all the things that we need to do as we move into the new organisation. The other thing to say is that we are working very closely with our partners in NHSE and NHS Digital, and as we've just discussed in the previous item, it will be highly likely that everything we bring in future to the board and to most of our discussions will have to have the lens of what does this mean for the transition period and what does this mean for our functions post-transition. So what I wanted to just lay out here, but also to suggest, was that we bring a regular update of to the public board, sharing the work plan that we are undertaking as we begin to develop it in the next few weeks, and sharing some progress, and probably also discussing at public board some of the issues that we must make sure we safeguard as we move into the new organisation. I would like to just ask as well that it is done in this public board, and then some of the detail can be taken at some of our board committees to work through. Thank you.
Okay, thanks, Navina. Any questions, comments on transition? No, okay. I'd want to just highlight that having been a member with Navina of the Joint Transition Group, that this feels a very inclusive process, where the contribution that Navina and I have been able to make has been listened to and acted upon. So I've actually found the spirit and the conduct of the initial meetings around the creation of a new organisation to be positive and, as I say, very, very inclusive. So I think that's important. Sometimes it can feel that these processes are a bit of a struggle in my experience, but that's not been my experience of this process to date. So I think that augurs well as we move forward. There's still a long way to go, but nevertheless it augurs well. So thank you. Liz, do you want to say something about the work that you lead on our behalf with the Public Advisory Forum, please?
Yeah, thanks to David. So the Public Advisory Forum works with HEE, it's people with lived experience, and we play them into all our groups and planning meetings to make sure that we make a positive impact on our end users and customers. And one of the, in the paper from the transition group that we've had to look at, it talks about how this positively has an influence on end users. So we've got the People's Advisory Forum tomorrow, and we're going to be discussing this, and it would be great to think that our PAF, our Patient Advisory Forum, could make a difference to this, could be on some of those groups and reflect the voice of lived experience in what we're planning.
Yeah, very good. Well, I hope to be able to join you for part of that meeting tomorrow, Liz, so it'd be good to just listen to that discussion, and then we can work out how best we can do that based on the conversation that you lead at the forum tomorrow. Any other questions, comments on this one? Okay, let's move on. Navina, thanks for that. So we then go on to rural and coastal transformation. So Patrick, this is back to you, please.
Thank you, David. And I won't use the presentation, but just talk to this. I'm joined by I think Adrian Tam, Regional Transformation Lead for Lincolnshire, and Andrew Dickinson, Dental Dean for Midlands and East, who have very much been part of this work. Purpose of this paper really is to highlight to the board the work that we're doing in this space and the approaches we're taking, to highlight some of the development work we've been doing and intend to do with our ICS colleagues, to look at the range and depth of the educational reform that is taking place that actually can really support rural and coastal agenda, and talk a little bit about the governance. This clearly resonates with the work that came out of Chris Whitty's, the Chief Medical Officer's annual report last year, who raised concerns about the health inequalities that were arising in coastal and rural areas, and particularly around provision of healthcare for those populations, particularly where they were with high social deprivation. And this particular work arose because I was invited to the ICS in Lincolnshire to talk about the Topple report and how digital education might support them in their own thinking. And Adrian very kindly picked me up from a train station in the middle of Lincolnshire, and after an hour's worth of driving, we still haven't arrived at the destination. And I suddenly realised actually it feels very different to be in Lincolnshire in terms of the approach and the impact that has on how we actually, I suppose, health services work, how they recruit and retain staff in very rural geographies, and also how we support education and training for such geographies. We talked with the National Centre for Health and Care, who are actually based in Lincolnshire, and they introduced us to Roger Strachan, who's a professor of rural healthcare in University of Waikato in New Zealand, who's world leader in this space. And the evidence that Roger provided us, and did a huge amount of work signposting us to different information, has in effect resulted in the programme that is in this paper. There are some key things I just want to pick out from Roger's work, and that is his evidence, particularly from Canada and Australia, is if you can anchor medical staff, if you can train, recruit and retain medical staff in a rural geography, then the other clinical staff are likely to then also more easily be recruited and retained. But if you get a vicious cycle of turnover of your medical staff, you're going to get the same turnover of the other clinical staff. That's the evidence. And the three key points he brought about from the evidence, again, Canada and Australia, was if you recruit into medical school people who have already lived in a rural area, the evidence shows you're probably more likely to have people who have experienced it, know what it's about, and are more likely to stay in that geography to work for future medical practice. The second is if you can provide experiences for medical students in the rural practice long enough to retain their interest and experience, they again are more likely to have an interest and they're likely to stay once they've graduated. And the final one is around clinical practice. If you give clinical practice to your trainees long enough and sustain in a sustained way, you're more likely to retain those individuals who will gain an interest in rural and coastal healthcare practice. And the whole premise of this report and our thinking has been around that. If we get that right, all the other interventions that HEE can do, of which there are many, will be helpful. We then mapped where was social deprivation high and where was NHS workforce staffing low, so that we could actually set some priorities. And we came up with 3 regions and 4 ICSs. So Lincolnshire, Norfolk and Waveney, which includes 2 geographies, the King's Lynn and Great Yarmouth, the North East Essex and East Kent. And we've been working and talking with those ICSs about how we might work with them to support a whole range of interventions that could really make a difference to them by, I suppose, through the lens of education and training and workforce development, support them in their recruitment and retention of clinical staff. I'm now going to, the other point I would make is that we've worked with Bola Owolabi, the Director of Health Inequalities at NHS England, who has set out a direction to all ICSs that they must look at the 20% of most socially deprived areas in their geography on supporting them on 5 clinical areas. And she doesn't have a workforce lens in her programme. And so one of her senior team is joining our steering group so that we can connect the 2 programmes. I think that's not only helpful in making that happen and giving her some workforce support, but also in terms of thinking of our transition, how we, from our workforce place, works with NHS England more closely in this space. I just want to ask very quickly, Andrew, just to add 2 minutes on dental and oral, and Adrian on Lincolnshire, and then I'll pause. Andrew. Yeah, we haven't got Andrew or Adrian by the looks of it. Is Adrian here? No. Then we can move on, David. Sorry, I know both of them because of the time changes. We're going to try and get here, but may not have been able to make it. So at this point, I'll pause. We've set up a steering group. This is very much regionally led with our ICS colleagues. The ICSs are very keen to make investment in this space with us, and we'll clearly are keen to bring back to the board how this progresses over the time. It's a multi-year piece of work, and it's multi-directorate. It's not my directorate, it's across the whole of DEC, Talent for Care and other areas. I'll pause at that point, David, to take questions, if that's okay.
Very good, Patrick, and I'm sure colleagues have read the papers that were circulated, and I have to say the document is a very rich document indeed, and I'm looking at page 15 of that document. So this is 22.8a, and that outlines the next steps that you're proposing. So in terms of taking this forward, the proposal is that you'll work with 4 localities within the ICSs to further develop this set of proposals. So what you're looking for here is support of the general thrust of this work. But also, I think it's support for the model of change that you're outlining, which is to work on a pilot basis and to, in a sense, convert this proof of concept basically into reality.
That's right, and the 3 core offers that we think, and the ICSs I think are in agreement with us, is if we get this medical anchoring piece right with the 3 pieces that Roger Strasser presents, that is a good opportunity. And both with the new medical schools in both Kent and Lincoln, they're both keen to see this happen with the widening participation agenda. And the wider work our own rural and coastal medical group, led by Namita Kumar, is working on. The second is around digital and health literacy, which our library services are working on with their Chartered Institute, which again supporting citizens in getting and improving their health literacy. And the third is through the Talent for Care programme in terms of the wider participation agenda and what we can do to support apprenticeships in local geographies, which of course is what Mark's team is working on. That is almost the core offer, and then it's for the local ICSs to determine the other interventions that make most sense for them based on their own local need. But again, using the Strasser evidence, it's around having enough interventions that shines a light on that geography that is then going to be of interest to other people and attracting other people into it.
Okay, thanks, thanks, Patrick. Shona, I'd like you to come in relation to this, because I know the location of the new medical schools was based on some of this underpinning logic about 80% of doctors that train in a geography end up remaining in that geography, or within 50 miles, I think it is, of that geography. So.
And David, Andrew Dickinson has arrived now, so it might be if I can ask Andrew to just give, if it's okay, just to give 2 minutes on his piece, because I think it is important around how we've managed to include the dental and oral and his position with the ICS in Norfolk, if that's okay, Andrew.
Yes, thank you, Patrick, and sorry to talk over Shona. Apologies for joining late. You seem to be ahead on the schedule, but this is a piece of work that we've been really looking already to implement within certain specific places, such as Norfolk and Waveney, where they've been taking a proof of concept and looking at how they can build that around their local requirements. That's obviously taken an element of investment. So they have been nominating key members of the workforce who will actually drive this forward, which of course will then help us in terms of evaluation. And the key thing that they're looking at is the whole multi-professional element, particularly within primary care, where we have most of the challenges on that rural and coastal workforce. That's particularly happening within dentistry, where it's very challenged in terms of access for patients, and it's built around a whole academy type concept, where there is a virtual resource for the workforce, so they can access contemporary information, they can upskill through the various education centres that are in the area, but all the time maintaining that link to the requirement for the local workforce. And I think this is where it is very much a change of the philosophy that we're asking within the ICS, that they are really understanding what their change agent is going to be, and this is what these steps are trying to introduce, and then map it against their priorities. So particularly it's looking at the inequalities. So it's the chronic disorders, it's the inequality element, particularly around mental health, and looking at how that can be addressed multi-professionally, both using non-medics, and that's again where dentistry, allied health professionals, and the primary care initiatives can all start to come together. It's obviously very early days, but it's the raising of the awareness that we notice with the ICSs, that they start to understand some of their key priorities and possibly how we can help to address that. Patrick, I'm going to stop there.
Thanks, Andrew.
Okay, all right. Thank you, Andrew. Andrew George, please.
Thank you very much for this, and I absolutely. I'm probably being a bit slow on the bit of it, because I totally get the coastal and rural issues that we need to do something about it. But it seems that if you look at it from HEE's point of view, what we're doing is we're offering things that are already in our armamentarium and we're applying them locally. So that is surely what we should be doing anyhow, frankly. I mean, there seems to be a learning curve for the ICS of how to perhaps use us or do that one, but we're doing stuff that we're doing anyway. And so what's different between this and what we should be doing in any area of deprivation, whether it's rural or whether it's in a city or you know, wherever it might be, coastal or wherever it might be? Isn't this what we should be doing anyhow? because it's for the ICS to determine the local health needs and then use the tools that we have to help them, and we can poke them and prod them a bit to make them think in the right way. And I guess my other question is, what I don't see in this is, how are we, what would success look like at the end of 5 years? What's success on this, and how would we know that we've achieved it, and therefore we should do more of it anyhow? So that's a bit mixed, but there's a bit I'm not quite getting, which is what's different for us.
Very, very fair question, Andrew. And the answer is yes, but this, I think, is trying to bring a focus around the 5 particular geographies we're talking about, and trying to make sure that what we do is happening in a more targeted way and a more consistent way. There's no way that we could do this across the whole of the country in one go with the resources we've got. So it's about targeting our expertise and our resources to the most needed geographies, demonstrating that the Strata framework works. It may not work in the UK, but actually I think his experience in Scotland shows it does. And that actually we can shine a light on these 5 in particular that have got the lowest clinical workforce and have a very high turnover. And it's trying to bring a change to that by the way that we do our interventions, working with the ICSs.
Patrick, can we just pursue it? And because I'm conscious that Adrian is doing some work on distribution of trainees, etc., and that was where I was coming from, about how does some of these things join up. And Andrew's asked it in a different way, but it ends in the same place really, which is how does this join? Patrick, let's take the weight off you. Shauna's literally and metaphorically got her hand up, so Shauna, go on.
Thank you, Tim. I think what's different is this is trying to bring together what you're talking about, Andrew. Shouldn't we be doing this? Yes, we are. We're doing lots of interventions around the place. We're trying to tackle a big problem in lots of different ways. What this does is bring together all the different interventions and really focus them in a few areas to see how much a consistent focus across all the programs can shift. So yes, Adrian's remote and rural work is tied into this. So is the work that we've been doing to attract trainees in with finance, with some of our terrace schemes. So have the incentives that the new medical schools have had with the new places. Some of the work that we've done to try and improve quality. This is bringing them all together and trying to focus with much more effective collaboration across an organisation. And I suppose one of the key things about doing this is, if we do this successfully, it is a good model for as we move into I&E, because it is not looking at doing something in hundreds of little silos that have a small impact, but it's trying to bring the work together. And that's what the paper describes. It describes lots of different pieces of work, and the intention is to focus them on 5 areas. So all the different work streams that affect inequality and distribution are, in a way, if you like, aligned and pushing in the one direction to see if that shifts it. Patrick, is that a fair description of what you're trying to achieve?
Absolutely. And, Roger Strasser's work shows that if you actually can focus a whole range of interventions in one place, you're more likely to bring around the success. If we spread this around the whole country, 1, we don't have the resources, and 2, you've got to be able to work with those individual ICSs on their own specific needs. And what's right for Lincolnshire, and particularly East Lincolnshire, is not going to be the same for what's right in tendering in Essex. We've got to then be able to shape our programme to support that.
So could I invite, look, there are people putting comments in the chat, and that means for people watching this back or watching it live, that's not visible to them. So Rob Smith, can I invite you to make your comment, please? And then Joe, can I invite you to make yours? And Mark, can I put you on notice about how widening participation plays into this as well? Because the important bit of this is there's a number, just to build on Shauna's point, there's a number of initiatives which are taking place which I think come together here and make the totality of the work program that we're taking forward. So it's not just about coastal and rural. And I just think we need to be able to demonstrate, at least to ourselves, that all these initiatives are joined up and they're not separate initiatives, i.e. we're acting as a corporate body rather than this team are doing a piece of work, this team are doing another piece of work, and somehow by magic it paints the picture that we need to take. I want to take the magic out of this and just put decent programme management into it. So Rob Smith and then Joe Lenihan and then Mark, please. Andrew, I will come back to you. Your hand was up, but Rob, briefly, please.
Yeah, thanks, David. You've basically made much of my point, which is not only do we need to make sure that HEE's different efforts are coordinated, which is what I think Patrick is trying to do, and make sure they are targeted on the specific challenge of the locale that you're talking about, which is not something we always do. Sometimes we have a standard offer and then we hope it fits. But our integrated planning framing says you need an all levers response to a service challenge in an area. So this is necessary but not sufficient. You still want things like, what does being a good employer in a remote and rural area look like? But getting our offer together is clearly a really useful first step or necessary step.
Yeah, thanks. Joe, please could you make your point as well?
Thanks, Dave. Exactly the right challenge. And I think for me, this work just shows the importance of place-based planning. That's why we're moving towards ICSs. As you say, it's not just about rural or coastal, but I think we're right to focus on that because we know those are the most challenged places. But traditionally, we've traded off training experience with staff experience and patient experience. So this gives us the opportunity to pull together all these different programs and projects dotted about the system. So it makes sense from a place-based point of view for the staff, for the trainees, and most importantly of all, the patients. So fully support this. And your challenge is right. As we move towards a new organisation, it's how we achieve the integration, which is the whole point of both our changes with NHS-EI and the ICSs, so that that is the objective. I think this project is a good one to hold our feet to the fire on.
Yeah, and I think the alignment with the transition to a new organisation, which is a repeat of the digital point I think that Navina made before she went on to her next meeting, is it also bears repetition here, I think, to get that alignment. And maybe Bowler provides that, but it's probably that plus a bit more as we It's more David, because we will be working with the regional service teams from NHS England as we do this. This is not HEE in isolation. Yeah, Mark, do you just want a sentence or two about wider participation in that spirit as well?
Yeah, thanks, David. And I think that is really important. The majority of the roles we have in NHS, and I would say this, and social care, are between the band 2 to 4. I know that kind of sometimes our focus is those on the band 5, the graduate professions leading to things, but we've also got to think about widening access is about entry to professions, so widening out the capability of people to join them, and the continuity of career, because that's another really important point, because actually some of our roles are gateways to others, nursing associate into the registered nurse, healthcare support worker into nursing associate, and also the capability to take people as a run through. And that must involve deep engagement with the local commerce, absolutely with the local authority. It must be involving further education and higher education. And these are the really critical things, because actually what this describes for me, if I was to take a huge step back, is actually the structural issues that we see in these communities around demographics, and importantly, the opportunity that's not available for lots of people, hence why they move out of these into larger urban populations and other areas of the country to seek out those opportunities through employment as an opportunity to have a meaningful career and opportunity. So I don't want us to lose the fact that the transformational nature this has on communities and individuals, but the lens by which we approach this is on the whole life course of training and education, right through from NHS and social care from bands 2 right up to consultant neurosurgeon or general practitioner or nurse consultant.
Okay, really helpful. So very quickly, colleagues, please, Liz, and then, sorry, John Latham, then Liz, Adrian, briefly. Okay. You've not got your 2 minutes, Adrian. I'm going to wind this up shortly.
Just to say, Yeah, I should say I'm really positive about this. We've got an example ourselves, just as a university going into Scarborough, a massive cold spot for the provision of health and social care education. We opened up there, very welcomed, but there's a massive demand that actually wasn't being met. So I think there are, it's not just about the coastal areas, but there are areas in the coastal areas where there is huge gaps of health and social care provision, particularly for the elderly. And I think, some of this can be a game changer, really.
Yeah. Liz?
Thanks, Sir David. It's a really great paper. I enjoyed reading it. Spent a lot of my career in Lancashire and South Cumbria that's got some really rural areas. And one of the examples there was just a mention at the end about transformation and upskilling of workforce, because I think it's great that we've got all these new ways to bring people in and keep them in rural areas. But then how do you upskill those people so their level of practice is the same as those in other areas who might get more opportunities for CPD and socialisation? So that, I think that was just one of the, it was mentioned in one of the case studies, but I just wondered if we were doing anything about that more broadly.
Thanks, Liz. Adrian, please.
Yeah, sorry, David. So apologies for being late. I thought I was in another board meeting. Just to build on Mark and Liz's points there, really, that in Lincolnshire they have already started a great piece of this work from a widening participation perspective on the East Coast, and that's the case study I think you're referring to, Liz, with what we call the Boston project, which was primed by HEE in my role as Workforce Transformation Manager. And actually in its first year has been quite successful with some of that, working locally with Boston College and that pipeline. They've attracted 43 trainee nursing associates into the programme running out of Boston, and also 23 paramedic science foundation or certificate of higher education program. So actually it is actually starting, and there is huge ambition to grow that, to grow the programs with the University of Lincoln, who were really behind the widening participation and inequality agenda within that within the proposed programme of work, and also combining that with the Campus for Future Living that's being developed in Mablethorpe and supported by the Towns Fund and the National Centre. Actually, we're going to really address that East Coast problem, and we can start to already see some of that coming through and addressing the wider population health management and health inequality agenda as well. So absolutely, it's a great piece of work, and definitely one to watch as it continues progression.
Thank you.
And in that spirit, I'd encourage us to think about what the impact measures are. So this would be about more staff settling, reduced turnover because people feel they're able to develop a career, more school leavers entering those different training and education work streams that Mark has referred to, etc. And you flagged some of the metrics that we might use, Patrick, and I just wondered whether we should revisit some of those. So I think what you were asking for is support for the approach, and I think you've got that in quite a conclusive way. I think I'm right in concluding that, Andrew George. You raised the questions at the beginning, I think quite appropriately. Do you feel answered and satisfied by what you've heard?
I feel much more answered. I still think this is something. This is something we should be doing anyhow, and so it feels to me that this is about new ways of working, and I would really like to see that evaluation in there. How do we actually? What does good look like? So that we know whether this is a good model or not, or how we actually act agilely as we develop this and drop some initiatives and take up other initiatives in order to get the outcomes that we want. But very enthusiastic about trying to turn this round. So yes, I think I'm much more convinced.
Andrew, the points that you've just made are hugely important, I think, and I would like them not to be lost, Nicola. When we come to create the minutes, I wonder whether we can capture those, and Patrick, if you and Adrian and Andrew could take them away and just reflect back into the programme. I'd also personally ask that we think about what's the narrative that describes this work, because the reason I invited lots of people in is that I think this is about how our programmes are integrated. So we've got various work streams and programmes, and actually there needs to be a narrative which binds them together. Otherwise, we're in danger of just running a sequence of programmes. And I think this is one of the examples where the whole can be greater than the sum of the parts if we can work in a much more integrated way. And then the last point I'd make, and it's the point, Patrick, that you're taking away from the conversation on digital first, which is how do we get alignment with the transition to a new organisation? This is absolutely the right thing to be doing, but actually the risk of developing this through a transition is quite high, it strikes me. And actually this feels too important to lose it through the transmission, to lose that sense of momentum. So how we get that alignment with the transition is something that I'd ask us to think about as we work the programme up. But thank you very much for that. Rob, before I close it down, you want to come in?
Yeah, I think there is a narrative, David. We brought our new operating model to the board 6 months ago with integrated planning at its heart, which is how we are going to work with ICSs. I think this is an applied version of that narrative. I wouldn't like us to lose sight of the fact that, you know, as Joe has said, this is going to be true of all ICSs. We know there's specific challenges for these communities. So I think we need just to reflect that we already do have a strong narrative on that area that we've agreed at this board.
And I think this is Andrew George's point. So what I wouldn't mind asking, well, let me rephrase that. What I would like to ask the exec team is when you're bringing papers to the board in the future, however we're sitting, whether it's a development session or a public or a private board, that actually there is that narrative is captured, Rob, in the way we present the papers. So rather than reaching for it through the discussions we're having, it's front and centre in the reports as we go into this year, because it's important that our public discussions as well as our private discussions, that is really central to the conversations that we're having. And I think if we can capture some of that, then that will be incredibly helpful as we go forward. So with that, I'll bring it to an end. Patrick, Adrian, Andrew, thank you for the work that you've done and the conversation that we've just had. If I can move on to the commercial policy, I think we're being asked to agree this policy. And Callum, is there anything you want to say about introduction?
It is exactly that. It's good practice to put these through the board, and we've there's a lot of focus on public bodies, obviously, to make sure that we're going about this in the right way. Cabinet Office are reviewing public bodies and so forth, and it is expected that these policies do go through board. So really, yeah, it's happy to take any questions. I think it's a really thorough, detailed explanation of how we handle commercial and procurement matters. Let's say any questions, happy to take them.
Any questions or comments? Sorry, I'm probably the nerd that read all of it then. So can you, one of the challenges around a commercial policy is how you deal with innovation, where you've got frameworks and lists of people, where there are new startups and new organisations coming in. How do we deal with that? If I'm a new startup and I want to get on the approved list of providers, etc., how do I do that when it can look locked down?
Well, it will depend somewhat. But approved list providers are there, open to all. I mean, it'll depend on which framework and so forth we're talking about. But you know, those are gone about in a procurement fashion, just like any individual procurement. So providers need to express their ability to deliver on the criteria set out, and it depends who's setting up the framework. A lot of the framework we deal with are actually pan NHS ones. Yeah, I mean, there's a certain amount of there's a balance, isn't there, between having a level playing field, but also having one that meets the strategic needs of the organisation, so that we're not dependent just necessarily on one supplier. Depends on what it is you're buying, but that's where our commissioning teams need to look at whether we've got sufficient diversity in the market. Normally, it's just a level playing field approach. Whether you're small, big, what have you, it's the best provider who can provide the best value for money that is where we want to go. But sometimes that's not always. If it's a very narrow market, we might want to look at diversity, in which case that would be put through into the terms of the procurement, and the procurement be weighted to encourage that. But ultimately, just because you're small doesn't mean you inevitably kind of get a pass through to the the final listing. So it does depend a little bit. But I think the paper you've got in front of you does explain that we do treat everyone equally, fairly, and according to best practice.
Okay, thank you. Rob.
Yeah, it's just frameworks are incredibly useful, aren't they? Because a lot of the bulk work is done in advance, and therefore you can be flexible. For me, Sir David, it's the extent to which they either remain open so new partners can apply to join, or that you review them frequently enough for new players to be retested. That's for our procurement colleagues to sort out, to get that balance just right. But the overall approach for me has always been constructive over the years I've used them, I'd have to say.
No, I agree. I agree, Rob. It's partly prompted by a letter that we've had in recently saying, we're a new organisation and we don't feel it's a level playing field. And just seeing the juxtaposition of that letter arriving and this paper coming, it's a legitimate question to test this policy that we're being asked to agree against. I think as a standard policy, it works. I'm left reflecting is what is the board's scope for decision when on page 30, approval of contractual expenditure, for instance, anything over 50 million we approve, but it's subject to DHSC agreeing and Treasury agreeing. It strikes me there's not a decision for the board. The only decision is don't proceed to DHSC and don't proceed to the Treasury. But that's the joy of a public sector board in 2022, I'm afraid. Any more comments? So my last comment was, are we, as we renew this policy, are we confident that the other schedules of delegation are consistent with this? I presume there's no changes from the last commercial policy that we agreed, and therefore there is alignment with the scheme of delegation, whether that's standing orders of finance, etc., etc. Yeah, we're okay.
Yeah. And we will be bringing updated ones to the next public board as we normally would at the start of the year.
Yeah. Okay. All right. So I think you're asking for approval of this, I think, Callum, aren't you?
Yes.
So, colleagues, are we content to approve this commercial policy for the year? Yeah. Okay. Enough people are nodding at me. So, thank you very much for that, Callum, and thanks to your team, Sean Hincliffe, I think, who's produced that. So that brings us to the board assurance framework as the last item on the agenda. David F, are you doing this?
Yes, I can do, Sir David. This is an updates report. We took a paper last time to the committee. The updates are highlighted for January for you to see the changes. And just to add, we've got into a process now whereby we take each section of the BAF through the exec, and each director reports on what's happening, what's changing, how they're monitoring and going to report back on this. So we're into a cycle now of regularly using this live in our sort of corporate meetings to make sure that we're on top of it and we understand the changes and the direction of travel. So this is just an update for the board, and I think the appropriate directors will be happy to take any questions on the updates.
And David, one of the reasons we put this to the end of the agenda was to ask the question that, in light of the discussion we've just had on both our public and private board meeting today, whether there needs to be any further review or reflection of the BAF, i.e. Does it still stand? So I found it really helpful that you'd highlighted the changes since the last one, as you have done in yellow. That was very personally very helpful to me. But I'm just left reflecting on, in light of the conversation we've had, whether we give enough weight to the transition to a new organisation here and how that will work its way through. And it's not to catch out. We couldn't have had the conversation about whether this is good at the beginning of the agenda, but taking it at the end of the agenda, we can actually just make that reflection. But let me bring Andrew Foster in and anybody else first, and then I'll give you the last word on it, David. Andrew, please.
Yeah, so my comment is specifically about the number 5, which is really the one about our staff, but it may well extend to some of the other ones too, which is that I think the People and Culture Committee are going to need to relook at this in the context of the merger. I mean, there are so many people issues that are thrown up by the merger, and at this stage the BAF is silent on that. So I feel that the people side should at least be updated, and the next meeting is in mid-February, where I'm sure we'll do that.
Yeah, no, very good. It's absolutely to the point, Andrew, about how we review this in light of the transition, I think. And I guess John Latham will be picking some of this up in the Audit and Risk Committee as well, and that will need to be reflected back into the BAF as well. Any more comments on this? David, do you want to come in then? And
yeah, just say that what the purpose of this obviously coming here is for us then to take any comments and recommend the changes back to the appropriate committee of the board, and the committee of the board that will then review it, make the amendments ready for the next board cycle. So we're sort of in that process. You'll see on this one we've got now a BAF number 6, which is around the transition to new organisation, but what we haven't got there is owner of it and detail of it. So what I'd suggest is that risk is, or that area is taken back into the exec team to follow up on the feedback that Navina gave today about taking a paper into every board meeting on an update on the transition, and using that paper to update the BAF continually on number 6. So I think an exec discussion to pin down ownership, the detail behind it, and then link it into that paper at each board meeting might help.
Yeah. Okay. And I think the consideration will be how far do we include transition just under number 6, or how, to Andrew's point, it influences others like the people agenda, etc., etc. But you know, that's to be worked out, David. I'm sure you'll do that as we begin to develop this work forward. So yeah, thank you. Anybody else on this item? Okay, I've not been notified of any other business, so I think that brings us to the end of our meeting, slightly early. So I'm sorry if I rushed us through thinking we didn't have enough time and we're now left with 15 minutes, but hey ho, occupational hazard of me chairing your meetings, I'm afraid. Big thank you to board colleagues for your contribution today. Big thank you for the work from the exec team and your teams to get the papers ready today. Callum, big thanks to your team for the budget and other work that you've done. I didn't say that earlier, and that was me being neglectful, so apologies for that, but a big thank you. Thanks also to the business planning colleagues for the work that they're undertaking and about to undertake. We will follow up and try and get a separate meeting in around transition, and that'll be a private meeting, and we'll try and do that in the next couple of weeks as we go forward. Written comments on the business planning to inform that in absence of a discussion earlier in our agenda, and I think that's pretty much the key highlights from both the private meeting and this meeting. So big thank you to you all, and we'll see you in a couple of weeks' time, I think, where we can come together and just spend a bit more time on the transition. And if we aim to try and get about 90 minutes, Nicola, if we can, might not be easy with everybody's diary, but if we can achieve that, then that will be, I think, very, very helpful. So, and then Callum, if you just say when you're good to go on the budget debate, and then we'll convene for, if we need a separate meeting, we'll come together for a separate meeting. Is that okay, everybody? All right. Yep. Thank you all very much indeed, and I'll catch you over the next few days. Liz, I'll see you tomorrow at the PAF, and I think I've got one-to-ones with a number of you over the next few days or so we can pick up any residual issues and any feedback from the meeting at those one-to-one meetings. So big thank you, everybody. Thanks. Bye now.
Thank you. Bye.